Hello, I'm Daytha, the PA and Women's Health Clinician at the Saline County Health Department, and I'm going to talk today about family planning options or birth control methods. Family planning is to improve women's health by spacing and planning the number of children that they have, and also providing preventative health care for all women, rich or poor. We do find that women who space their children at least 2 years apart have healthier babies and have better health themselves. Family planning was pretty uneventful until the 1960s. The FDA then approved Inovid, which was the first birth control pill available on the market, and IUDs were also granted approval in 1968. Approximately 50% of all pregnancies are unintended, and half of the unintended pregnancies are among couples who are not using any type of contraception, but the other half is seen in people using contraception but possibly not using it correctly or consistently. The goals of contraceptive are, of course, to prevent unintended pregnancy, to help women and their partners choose a method that's appropriate for them, and to teach couples how to use their chosen method correctly and consistently. To decide what is the best fit for a couple, we look at the effectiveness, the method of action, how it is used, contraindications, risks, side effects, the cost, lifestyle of the couple, their sexual activity, and medical history. We need to understand the willingness of a couple to use a particular method because it does not work if they don't use it. Any method of birth control is only as good as how well you can and will use it. There is one method of birth control that is 100% safe and effective, and that is abstinence. It is 100% to prevent both pregnancy and STIs. For those who do not want to practice abstinence, we have many different methods. The oral contraceptive is a very popular method of birth control. We have both combination pills, which contain both estrogen and progesterone, as well as the progesterone-only pill, also known as the mini pill. The pill works by suppressing ovulation, keeping the egg from popping out of the ovary, and so it cannot be fertilized. Also, the pill works to change the uterine lining, making it inhospitable to the sperm. I like to say that it changes the uterine lining from a swimming pool to a skating rink so that the sperm cannot get through the uterus as well. It also affects tubal transport of the sperm, and it thickens the cervical mucus so the sperm cannot get through as well either. So it works in several different ways to prevent the sperm and egg from uniting. If used consistently and correctly, its typical failure rate is only 2%. It is safe for most women. It can protect against PID because of the thickened cervical mucus. The only STI that it doesn't work very well for is chlamydia because it can still get through there. It is a very effective contraception, 98% effective or more. It can often be used for the medical benefits of lighter and shorter periods and less cramping and pain with periods. It can help reduce acne and decreases the incidence of ovarian cysts since it prevents ovulation. It can decrease the incidence of fibrocystic breasts. There's no interference of the contraception with spontaneity of sexual intercourse. It's very easily reversible. Women can actually attempt to get pregnant as soon as they go off the birth control pill. It may have some protective effects against ovarian and endometrial cancer. Some studies show that women are 80% less likely to develop ovarian and uterine cancer if they take the pill for 5 years. It can be protective against iron deficiency anemia because it reduces the menstrual flow, and there's been years of research on the birth control pills, and we have gone from much higher doses to much lower doses, which are still very effective. Some side effects of the birth control include nausea, weight gain, breast tenderness, headaches. This was seen more with our higher dose estrogen birth control pills. Most of our birth control pills now have 35 micrograms or less of estrogen, where they used to have 80, even up to 100 micrograms of estrogen. So there's much less side effects with our newer birth control pills. Sometimes women can have spotting between periods. Sometimes they will skip a period or have decreased menstrual flow, which most women do not find to be a problem. They can have more yeast yeast infections or vaginal itching and discharge, but again, we saw that more with our higher estrogen pills. Depression, mood changes, and fatigue can occur with some of the progesterones in the pill, but usually changing to a pill with a different progesterone can alleviate that side effect. Our most concerning side effects of the birth control pill is gallbladder disease, because the pill is broken down by the liver and goes through the gallbladder. In certain people, the birth control pill can affect certain hormones in the kidney and aggravate hypertension, so that is why we always check our patients' blood pressures when they come for yearlies and to pick up pills. The most serious side effect is blood clots, which can cause strokes and heart attack, but we see that mainly in women over 35 that smoke or women who have a family history of clotting disorders. So that's why we do a thorough history and just make sure there's no family or personal history of blood clots. We have the hormone patch, which has both the estrogen and progesterone and works very much the way the birth control pill does. It is placed once a week for 3 weeks and then left off for a week for the menstrual period, and then the woman starts a new packet of the patches. Usually they stick quite well. We tell women that they can place them anywhere but on the breast, because it can cause breast tenderness. It has the same benefits and risks of the pill, but sometimes it's better for women who have GI upset with the oral contraceptives, since it does not have to go through the GI tract. Rarely there's problems with the patch staying on, but they've done quite a bit of research and really have good adhesive on these patches, so most times they stick quite well. We also have the vaginal ring, which again has the same hormones as the birth control pill, only in a little bit lower doses. This is a ring that's placed in the vagina for 3 weeks and left in place for the 3 weeks and then removed for a week to have the period. Again, it's a good one for women who may have GI upset with the birth control pills, and especially for women who have trouble remembering to take a pill every day. We have 2 different kinds of ring. We have the Nuva ring, which lasts for 3 weeks, so a woman places a new ring after each cycle. And then we have one called Anavira that is actually good for a year. The woman removes it every 3 weeks to have a menstrual period and can just dry it and store it in a little case and then put it back in after a week. So we do have 2 different types of rings available now. And then we have the progesterone-only contraceptives. This include the Depo-Provera injection, implants under the skin, intrauterine devices, and we do also have progesterone-only pill. Again, these work by thickening the cervical mucus, thinning the endometrium, inhibiting ovulation, and premature destruction of the corpus luteum, which is a little area if an egg does pop out of the ovary. This area is formed to produce progesterone to maintain a pregnancy. So if a corpus luteum isn't there, a pregnancy would not be viable. We have the mini pill, which is the progesterone-only pill. There are no days off. Women take a hormone pill with the progesterone every day, and it maintains the progesterone levels at a constant level, again preventing ovulation and thicken the cervical mucus, just like the other contraceptive birth control pills. It has no estrogen-related side effects, so it may be good for someone who's had blood clots, that type of thing, or other cardiovascular problems. There's a thought that there might be a decreased risk of malignancies, especially breast cancer with this one, although not found that strong relationship between breast cancer and birth control pill. It's less likely to cause headaches and blood pressure problems, again, because it does not have the estrogen that would affect the cardiovascular system and the kidneys and blood pressure. Women do have decreased menstrual bleeding, although the bleeding may be a little more irregular since there's no time off the pill to give a woman a chance to have a menstrual bleed. It's very easily reversible, and the one big benefit, this one can be used in breastfeeding, does not decrease breast milk production, is very safe for the baby. So this is a good one to use for women that are breastfeeding, but maybe not totally breastfeeding and need a little backup contraception. Disadvantages are increased risk of ectopic pregnancy, because women are a little more likely to ovulate with this one. The menstrual cycle irregularities that we mentioned, and ovarian cysts can occur at a slightly higher rate than than the combination pills. And it's not quite as effective as the combination pill. Its effectiveness is only about 90%. Then we have the Depo-Provera injection. It is similar to other progesterone-only contraceptives in its method. It's administered by injection every 12 weeks, but we do have a little leeway. We can give it between 10 and 13 weeks, and there is some new evidence that it might be good even up to 15 weeks. It's highly effective, no estrogen-related side effects, culturally acceptable. I do have some patients that maybe their husband doesn't want them to be on any type of birth control, and they can come in and get that shot every 3 months and be protected, and no one knows. There's very few drug interactions with the oral contraceptives. We have to think about antibiotics and some of the anti-TB medicines and that type of thing. We don't have to worry about that with our Depo-Provera. It's long-acting. Sometimes many women do not have a period at all with it, which they like. And of course, if they do, it's very light and maybe just every 3 months when it's about time for the shot. And there's a very low risk of ectopic pregnancy with this. It does a pretty good job of preventing ovulation. The disadvantages are weight gain. About 20% of women do gain weight with the Depo-Provera. Usually it's women who already have a higher BMI. Return to fertility may be delayed. It may take 6 months up to a year, and even I've had a few patients, it's been about 18 months before they could start having periods and could become pregnant again after being on the Depo-Provera. It doesn't totally decrease a woman's long-term fertility, but it can delay it. So it's not the best method for someone who wants a child within the next year. Some women find that just getting an injection, having to come to a clinic and getting an injection, can be a disadvantage. It does increase the good cholesterol levels a little bit in some patients, and there's also a concern that bone density may be decreased while on the Depo-Provera because it doesn't have any estrogen in it, and estrogen helps our bones healthy. However, they've found that women who have been on the Depo-Provera long term, once they go off of it, their bone density tends to return to normal, and the women who have been on it long term do not seem to have more osteoporosis as they get older than women who have not been on it. Then we have IUDs. We have both copper and progesterone IUDs. The Paragard is the copper IUD, and it is good for 10 years. We have the Liletta, which is good for 8 years. The Mirena, which also has been recently approved to last for 8 years. We have a Kylena, which is good for 5 years, and a Skyla, which is good for 3 years. And the last 4 are all progesterone IUDs. And they are suitable for women of any age. It used to be that we did not use IUDs in women who hadn't had children or women under 25 because they felt that it'd be difficult to insert. But we have our newer IUDs, especially the Liletta, Kylena, Skyla, are a little bit smaller and in diameter and easier to insert, so we can use them even in teens. It's not certain how the IUDs prevent pregnancy. It is thought that maybe they have caused changes in the cervical mucus, especially the progesterone IUDs probably cause that same thickening of the cervical mucus that the birth control pills and other progesterone methods do. With the copper IUD, it's thought that maybe there's an inflammatory response to the copper that prevents implantation and immobilizes the sperm. Also, again, the uterine lining can be thinned, especially with the progesterone IUDs. It inhibits fertilization. When placed, the IUD should be about 97 to 99% effective in preventing pregnancy. It's a very effective method. Some possible side effects include increased bleeding, hemorrhaging, and anemia, mostly with the copper IUD because women can have a little heavier periods with the copper IUD. They also may have cramping and pain, especially if they had heavy periods and cramping before they used this contraceptive. Sometimes irregular spotting can occur the first few months, and especially with the progesterone IUDs, as continuous release of the progesterone into that lining, which tends to thin it. Also, the IUD string can be lost, although that's not very common, pretty rare for that to happen, and it can be difficult to remove in some patients. Again, usually they're pretty easy to remove when it's time to remove it and think of whether the person wants something different or another one. And the disadvantage is there is an increased risk of PID, although with our newer IUDs, we have a monofilament string that is much less likely to cause bacteria to move up into the uterus. So we're not as concerned as with our older IUDs that had these multiple filament string, which were just a good media for the bacteria to progress up into the uterus. They can be spontaneously expelled held, although that's pretty rare. Possibly can increase the likelihood of ectopic pregnancy because, again, ovulation is not suppressed with the IUDs. Uterine perforation and embedding in the uterus, again, are very rare side effects and probably seen more with our older IUDs. They're highly effective. They do not interfere with sexual intercourse. There's nothing to insert, swallow, or remember. And the progesterone IUDs actually have been used for women who are having heavy crampy periods to decrease their menstrual flow and possibly even decrease the menstrual cramping because of the progesterone in them and not having the heavy periods. We also have the implant, which is a progesterone-only method that, again, avoids the side effects of estrogen. It's known to be effective for 3 years. Possibly we will be finding with research that this will be effective even longer. It's placed in the upper arm, and it can be placed in 2 different directions in each arm so that the person can use this method for probably about 12 years or use 4 of the implants. It is probably our most effective method of birth control with a failure rate of only 0.05%. The main side effect is irregular spotting and bleeding, again, because it's progesterone only without the cycles of estrogen and progesterone that trigger menstrual period. Then we have the diaphragm, which was very common in my early career, but I don't see very many people use this at all. It acts as a barrier to keep the sperm from getting to the cervix and into the cervical opening. Usually we recommend to use a contraceptive gel around the edges and in the center of the diaphragm in case any sperm might travel around the rim of the diaphragm. When properly used with every act of intercourse, the diaphragm can be up to 98% effective, especially when used with the spermicidal jelly and cream. In actual use, they're about only 85% effective. There are a few side effects. Some couples can be allergic to the sperm or jelly, but usually people do pretty well with that, and it can be as a lubricant for intercourse. It does not affect menstruation or ovulation because there's no hormones in the woman's system. It may provide some protection against cervical cancer because it's covering the cervix, and the cervix is less likely to be infected with HPV virus. It does require a clinic visit and a pelvic exam and needs to be fitted by a professional that knows how to fit them. I've found that many young providers now have not been trained on how to fit diaphragms, so that is a concern. It can interfere with the spontaneity as the couple has to stop and be sure to put the diaphragm in. It can be messy with the spermicidal cream and jelly, and of course there's the added cost of the spermicidal creams or jellies. It may impact oral genital sex because the creams and jellies have a bad taste. Now we have the sponge, which contains sperm killing agents, the same as in foams, creams, and jellies. It provides continuous protection up to 24 hours, where the diaphragm usually is only good for about 4 to 6 hours after intercourse. This can be left in place for 24. It has a concave dimple, and it just fits right over the cervix. It's a one-size-fits-all, so it does not have to be fitted like the diaphragm. It can absorb and trap sperm. Its effectiveness only about 75%. Failure rate 17 to 25 pregnancies per 100, making it not one of the most effective methods, but still it's a very good method for couples who don't have sex very often, and they can buy it over the counter at any pharmacy or street store. Advantage is that it has very few side effects, doesn't affect menstruation or ovulation. It again may give some protection against cervical dysplasia, cervical cancers by protecting the cervix from the HPV virus. It provides continuous protection up to 24 hours and requires no additional measures for repeated intercourse during that time. It does not require the clinic visit. Cost may be prohibitive for some users. It can be a little difficult to remove, although there is a little string on it that makes it pretty easy to grasp with the finger tip and pull that out of the vagina. Again, like the diaphragm, it does have to be placed in the vagina before sexual intercourse. Then we have the condom. Condoms are worn over the erect penis and prevent the male ejaculatory fluid fluid being released in the vagina. It provides a protective barrier against infectious diseases, STIs. We have latex, polyurethane, and natural skin condoms, which provide a barrier against the sperm. Due to the porous nature of natural skin condoms, only latex and polyurethane are recommended for STI protection. Their effectiveness, when used consistently and correctly, can be up to 90% effective for STIs, but they're only about 70 to 80% effective to prevent pregnancy. So they actually work the best to prevent STIs. And advantages, they're relatively inexpensive. They're more effective if used with a contraceptive foam. They are good protection from STIs, including HIV. They can prevent premature ejaculation. They give the male responsibility for contraception. They're available over the counter, very few physical side effects, and again may prevent cervical dysplasia and cancers due to the protection of the cervix from HPV virus. Disadvantages, they may interrupt foreplay, they reduce sensitivity for some men, they require preparation prior to intercourse, they can tear or come off the vagina, and for people who are allergic to latex or spermicides, this can be a problem. We have a female condom which has 2 rings similar to the diaphragm that fits inside the vagina and over the cervix, and then there's another ring at the other end of this female condom that fits over the vaginal opening, and it has the same advantages and disadvantages in the male condom. The male and female condoms should not be used together as they can adhere to one another and cause slippage of one or both devices. Then we have the vaginal spermicidals. They work as a barrier method to prevent the sperm from reaching the egg. Also, they have ingredients which can kill the sperm. However, they're only about 70% effective. Their lower effectiveness is thought to be due to improper use. They may be protective against PID. Since they do kill sperm, they probably also kill some of the bacteria and viruses. They are available over the counter. They may be messy, however, and interrupt foreplay, and they can be cost prohibitive to some patients because of the need to use it every time they have intercourse. Then we have a new kid on the block called Phexxi. It's a non-hormonal pH modulator that keeps the pH of the vagina at 3.5 to 4.5 range, which decreases the motility of the sperm. Semen entering the vagina usually produces a pH of about 6.5 to 7.2. It works immediately after insertion, prior to intercourse, and lasts for about an hour after insertion. It comes in a pre-filled applicator for one-time use. It's about 86% effective. It can cause some vaginal burning, itching, or urinary tract and vaginal infections. It can also possibly cause some burning and itching for the male partner. Then we have the fertility awareness, natural family planning. There's several different methods. We do not work with this at the health department, but we have some providers in town that are specially trained to work with fertility awareness that we can refer our patients to. We have the calendar rhythm method, standard day method, has several different names, where the person charts their menstrual periods, and if they have pretty regular menstrual periods, they can, based on the length of the previous cycles, they can determine what days of the cycle they may be ovulating, and then avoid intercourse during that time for about 2 to 3 days before ovulation and 2 to 3 days after. They can also use the basal body temperature method, where they take their temperature every morning before they get out of bed, and when they see a little dip and then a peak in the temperature readings, they know they've ovulated. There's also the mucus method, where a woman can put her finger on her cervix and obtain some cervical vaginal mucus, and if it becomes very stretchy, then that means that she's ovulated, as the mucus becomes more sticky during that time. Then we have the symptothermal method, where women can combine several of these different methods by breast tenderness, abdominal cramping, fluid retention, some of those symptoms, as well as looking at temperature and cervical mucus. The effectiveness rate of this depends on the method used, as well as the motivation of the couple and correct use of the method. Couples can report an effectiveness of about 95%, others about 70%. There is a high pregnancy rate with this method if not used consistently and correctly. It's safe for all women, does not produce any physical side effects because there's no hormones involved. It increases understanding of cycle changes and may increase the couple's communication. And it involves shared responsibility. It's free unless ovulation predictor kits are used. It may be acceptable to religious groups that oppose other methods. Also, it can be used to help plan a pregnancy. And an OBGYN I worked with said that the rhythm method or natural family planning probably was better for becoming pregnant, used to become pregnant, than it was to prevent pregnancy. It is completely reversible. Disadvantages include it requires charting before the method can be used. It requires a great deal of motivation and commitment on the part of the couple. It requires time and effort in learning the process. Requires periodic abstinence and a very supportive partner. Some women have trouble learning to identify their mucus and body changes, and women that have irregular and frequent cycles, such as women that have PCOS, may have problems using this method. Also, irregular schedules or sleep patterns make temperature readings in effect. Then we have the withdrawal method, coitus interruptus. This method depends on the male pulling penis out of the vagina before ejaculation. It's only about 60 to 70% effective because some of the sperm sometimes can be released before ejaculation. So this is a method we don't really recommend. Then we have emergency contraception for women who have experienced inactive, unprotected intercourse. This is women who are not on any type of birth control at all, or if the condom breaks or comes off. It's often called the morning after pill or interception or postcoital contraception. It's for emergency use only. It's not recommended for routine use because it is less effective than regular contraceptives. It's only about 70 to 75% effective. It works by delaying or inhibiting ovulation, altering transport of sperm or ovum, and altering the uterine lining. It does need to be used within 72 hours after unprotected intercourse. We have some different methods of emergency contraception. We can use combined birth control pills in 2 doses, about 12 hours apart. We also have the levonorgestrel, which is a progesterone-only method. It's called Plan B over the counter. We also have a prescription uripristal acetate, or name brand Ella, which is a 1 dose and does need to be prescribed. Also, the copper IUDs can be placed and used as emergency contraception and then left as a continued contraceptive. Reliable contraception does need to be started after use of hormonal contraception. However, with the Ella, the woman must wait at least 5 days before starting a progesterone-containing contraception because it is a contraceptive blocker, and using progesterone would make the Ella less effective. Thank you.